right. Well, thank you everybody for taking some time to be with us here today. I see that folks are using the chat box to let us know who you are and where you're from. Additionally, in the chat box, there is a link to download the presentation materials for today's presentation. And at this point, I'm going to hand it over to Michelle.
Okay, thank you, Tara. Well, greetings and a warm hello out there. I hope everyone is doing well this Thursday afternoon. And welcome back if you joined us from last week. And if this is your first time attending, well, we're happy to have you join us as a first timer with today's presentation on home visiting during social distancing. Today is the second of a four-part series for community health workers designed in collaboration with the Johns Hopkins Center for American Indian Health, focusing on core areas that community health workers will need to develop as they work in their communities navigating today's coronavirus. I'm Michelle Archuleta, and I am the National Community Health Representative Consultant and Community Health Team Lead with the Indian Health Service. I'm an enrolled member of the Lone Pine Paiute Shoshone Tribe from the Owens Valley in California, and we are fortunate to have two experienced and very talented presenters for today's webinar session. We have Tara Stobanenko and Jamie Begay, who join us from the Johns Hopkins School of Public Health Center for American Indian Health. Ms. Stobanenko, or Tara, is an implementation and technical assistance specialist with the Family Spirit Program. So many of you know Tara. And Ms. Begay is a Family Spirit training and affiliate liaison with the Family Spirit Program. And so rounding out our presentation, we have included a panel team comprised of program consultants with the Indian Health Service and the Johns Hopkins University that will assist with your Q&A during this presentation and at the end. So with that, I would like to say thank you to all the participants on the call, our presenters, and the panel team. And a super big thank you goes out to all the people who have worked behind the scenes that make this seminar series such an exciting event. And so with that, I want to say welcome again, thank you, and back to you, Tara.
Thank you, Michelle. Okay, so good morning, everybody, and thanks for joining us. As I mentioned, you can use the chat box to let us know who you are. We have over 100 people on today, so that's quite a crowd. And as we go through, we will be using the chat box to ask you to chime in on some of the questions or topics that we're discussing so that we can all kind of learn from each other. Again, my name is Tara, and as Michelle explained, I work with the Johns Hopkins Family Spirit Program. I support home visiting programs nationwide by offering them technical assistance with implementation of their programs. I'm joining you all today from Sacramento, California, and I always like to talk about being here from Sacramento and the connection we have to the rivers. So here where I'm at, the American and Sacramento rivers join to travel out to the ocean together. This convergence of the rivers and then the journey that they take together offers so much medicine that has provided a sustenance and healing and ceremony to tribal people in the area for centuries. So as we grow more and more urban, I always want to take a moment to recognize how the water continues to be such a significant resource. Before diving into the presentation today, I wanted to take a moment also to acknowledge the new and uncertain times that we're facing. You see here on your screen a short quote by Dr. Martin Luther King Jr. that says that the ultimate measure of a person or a team is not where they stand in moments of comfort and convenience, but where they stand in times of challenge. So we chose this quote because it relates to the historical nature of you all as community health representatives and community health workers. And in that during challenging times for communities like the one we're facing now, it's you all who have mobilized as boots on the ground to keep elders and families as healthy and safe as possible. So we wanted to take a moment to acknowledge all of you. Using the chat box, I wanted to ask if you would share with us one way that your team is rising to the challenge during this time. So what's one way that you guys are really stepping outside of the box and providing such great services to your community? All right, and we're gonna kind of move on from there. We'll kind of check back into your responses as we go along. And so during our presentation today, the objectives that we're going to be looking at are really discussing home visitor roles and safety. We're going to talk about the guidelines for virtual home visits and what those should look like. Additionally, we'll cover some documentation considerations. And then lastly, touch on community resources and the importance of knowing how we can keep families and patients connected to those key services. So looking at the chat, folks are calling families, they're supporting each other, really just keeping in contact, right? Delivering food, that's a huge one. We're seeing that all over the country, that bringing food and bringing resources out to the community is so needed. And then that emphasis on communication and connecting. Great, thank you. So at this point, I'm gonna hand it over to Jamie, and she's gonna take us through talking about the home visitor role and safety.
Thank you, Tara. Hello, everybody. I'm so glad you were able to join us. My name is Jamie Begay, and I work in Tuba City with the Johns Hopkins Center for American Indian Health with the Family Spirit Program. I've been with the center for, let's see, I believe it's 3 years now, coming upon that. So here we're going to talk a little bit about the home visitor role and safety. You can go to the next slide, Sarah. So as many of you know, the IHS response to COVID-19 comes in two forms that we'll be talking about today, which is the community-based health programs. So one of them is the Community Health Representative Program, or otherwise known as the CHR program, which provides healthcare, health promotion, and disease prevention services. We also help with community-oriented primary health services to improve and maintain health. In addition to, a lot of our CHRs are from their own communities, so they're well equipped with the experience to be effective advocates. We also, as CHRs, provide health education, which essentially reduces hospital readmissions and contributes to lowering mortality rates. Another program based in the community is health promotion and disease prevention. In my community, we also call it the Hippy Dippy program, which improves health by enhancing preventative efforts at all levels and develop and implements effective health promotion and chronic disease prevention programs. Next slide. So a lot of you are aware of what your roles are as community-based health workers. We understand the disease and to stay current with the recommendations. We also provide communication with our patients or participants, so we're able to listen to their concerns, provide factual education, and we also are aware of cultural competency within our communities, and then dispelling myths. And the service coordination, as community-based health workers, we also are the bridge to linking our patients with local resources. So if your communities have a resource guide that is essential in this time. We also, as community-based health workers, provide wellness checks. So looking to see if they need medication refills, mental health services, or if they need essential items. If they need food or water, coal or wood, we're able to link them to those programs who provide those resources. And the last but not least, empowerment. So helping individuals and families recognize the needs and advocate for themselves. So here we have the home visitor safety during this pandemic. As you know, we all are part of different entities, part of different organizations. So it's important to follow the guidelines set forth. We also want to avoid in-person home visits unless otherwise directed. And then we also want to practice social distancing, so increasing the space, physical space between people to avoid spreading the illness. Do want to mention that, social distancing is not, social disconnection. So we want to keep those connections that we have with our patients. Next slide.
Sorry, Jamie, I just wanted to interrupt really quickly. I know last webinar we had some questions about resources for safely re-entering, as the states are opening, how are we going to safely do home visits? And there is a webinar next week that is being provided by Parents as Teachers. It's another home visiting model. And they're going to be talking about how to stay safe and deliver services when states are starting to reopen. So I'm going to put the link to that in the chat box for those of you who are interested.
Thank you, Tara. So here's an infographic that I'm sure a lot of you have seen before, and it just goes to show how the power of social distancing can essentially flatten the curve. The more that we social distance, the less people who get infected. And here we just want to point out, we're all valuable people within our communities. We're the connection of medical services for our patients. We provide that bridge for them. So here are just a few mental health things that you can do to, take care of yourself so that we're able to take care of our communities. And please utilize this as a guide if you would like to reference it back.
Great, thank you, Jamie.
Mm-hmm.
All right, before we dig into virtual visits, let's take a look. We have one question about social distancing being 12 feet now. Is this true? So I don't know if if Brooke or Jessica, if you want to chime in to that question in the Q&A box, and then we can get that answered, but we're going to continue moving on. All right, so thinking a little bit more about virtual home visits, and we've been talking, we want to talk a little bit how to conduct those. Before we dive in though, I want to make a quick disclaimer because we have a bunch of, icons up here of different services that programs are using and that are become really popular right now. So Zoom itself, what we're using today, is not an approved platform for IHS employees. You all as federal employees use Cisco. That's another meeting platform, and an account is required. So, we're gonna talk about multiple ways that you can connect and different apps or programs because there's such a high diversity of folks here. So knowing what is approved by your agency and your funders is very important. And I want to quickly ask again in the chat box, can you tell us a little bit about how you're connecting with participants? So are you using any of these particular platforms? What are you finding to be most helpful? Moving on, you may have seen this visual before because if you've attended any of our recent town hall or previous webinars, so I'm going to just fly through these so that we can talk a little bit in depth about virtual home visits. But we did want to touch on this role of community health workers specific to COVID right now. So this first component here is prevent, and you're really, how you're impacting this response to the epidemic or the pandemic in this area is really definitely staying home if you're not feeling good. You may be involved in organizing and carrying out social media campaigns. We know that there's a ton of things going on Facebook, and that's really how a lot of information is being shared right now, right? It's important to encourage communities to connect with each other and promote health, physical and mental health. Somebody already talked about delivering food and medications to elderly and vulnerable residents, and then wearing masks. I think this is a pretty hot topic, just in the past week about masks and wearing those. And right now we want to encourage everybody to wear them when they're out of the house. Going into the second component, which is detect. So you all becoming aware of the signs and symptoms of COVID is going to be helpful. And then where to turn when you have questions. For example, hotlines that are run by maybe your organization or those larger entities like Johns Hopkins and hospitals or public health departments in your area. and then referring possible patients to get testing and helping organize transportation. The third component is treat. So, calling people and keeping in connection with them to help monitor for worsening symptoms is going to be helpful, especially when not everybody has a quick access to hospitals. Providing moral support and, again, food, supporting a rapid referral. Things are changing so fast that knowing who to call and when is going to be really helpful in the event that it has to happen fast. And then contact tracing. I know we touched on this during the last webinar, and this is probably something that'll be coming up more, but contact tracing and where you can be involved in that. We want to ensure access to testing and treatment, or being aware of where folks can get tested in your area, and then any ideas for raising funds. Lastly is recover, and I think we're entering kind of a, part of this component now as states are starting to reopen. So where we can be effective here is coordinating healthcare services, supporting folks getting connected to those services. And then there is this idea of developing a recovery timeline and setting benchmarks or evaluate and monitor outcomes. So how is this looking as we go along? How are things changing, and who's documenting that? We want to share some best practices amongst our teams, and then with our communities that we're working with. We want to partner with healthcare systems to ensure that everybody's kind of getting back in the routine to go to these appointments, because we know that healthcare issues don't stop, right? Our needs for medicine and things like that don't stop with COVID. And then supporting some local economic recovery. So after talking about that a little bit, at this point, I want to transition to exploring how programs and services have changed with COVID. So many of you are offering virtual or remote home visits, or will be offering kind of a modified version of that. So our way of adapting and still meeting our community needs is important. But how is the community going to know that your services are changed, or how they need to access them? And it's important to take this into consideration, and how you're going to inform the community and other agencies and programs that you work with, including those participants and patients that you work with. How are we letting them know updates on our services? Another thing to think about is recruitment. So some programs are accepting patients or accepting new enrollees and getting them going. So being aware if that's what your program is doing, and what does that look like, because we may not be at a fax machine to receive a referral form, right? So what's that new system for receiving referrals? And then being kind of clear about what your participants or your patients can expect from you. We're in this and we're trying to do the best that we can, but we cannot do everything. And so there may be services that patients need that you're not able to do, and being very clear what you have the capacity to do and what they can expect from your program right now is going to be helpful. Looking at the chat, we have a lot of folks have chimed in talking about helping with meal deliveries and groceries. So food is a big one. I keep hearing that. Delivering medications, helping with transportation. We know that that's pretty normal in our day-to-day for a lot of CHRs, but even more now, right? Because for those who maybe have used public transportation, that's not as available as it used to be. Great, thank you. So continuing on this discussion about how our services are changing, let's take a quick look at policies and procedures. It's everybody's favorite. I know, nobody has to get too excited about it. But while majority of your policies and procedures are going to stay the same, there might be some adjustments that are needed, right? For example, in emergency situations, you're all familiar with your responsibilities as mandated reporters, but now that you're doing visits on the phone or through video, you may have some questions that come up that you haven't had before, right? So it's wise to consider updating your protocols and have methods in place to contact your supervisor when you encounter situations or concerns, or an emergency. What is the best way to reach your supervisor immediately is going to be helpful to know and document. There's also this idea that maybe your supervisor, if you're on the phone with a patient or a participant, your supervisor could three-way in or join the video call if you have questions. So talking about that amongst your team and seeing how that works best for you will be one component that you want to take into consideration. Next is this idea of consent. So during this time, you might not have the opportunity to have a signed paper form. One tip that we have is to go back and look at this and say, okay, how are we going to do consent in this age of COVID when everybody's at home? And then the last idea is the concept of storage of data. So we're going to talk a little bit more about this later in the presentation, but we just want to remind you that email and texting are not secure, and patient information should not be shared through those forms of communication, and thinking about how we're going to store patient information, right? Okay, let's talk a little bit now about technology. So this is very different across so many areas of our country. Some of you as CHRs have more access to technology than others, and same with our families or the communities and patients we work with. So at the beginning, I briefly showed some visuals of different platforms, and you can probably imagine that there's a ton of possibilities, like I said. So what I'd like to focus on here is knowing that technology is often an area where people are not super familiar. So, you know, who are you going to call if you have questions? Just like we have our supervisor who's available, who is it that you can contact, or where are some resources to access when you have questions about technology, because it's going to come up, right? Some of it's as easy as Googling what's going on, but maybe you should have a protocol on connecting with an IT person. These are some basic technologies that you're going to need. So, definitely email and text, knowing how to download applications, knowing about links and documents, and then a webcam. These are just some basic stuff that if you're not super familiar with them, it might be helpful to kind of brush up on that stuff. And again, touching on this use of email, we just want to make sure that, what can be sent in a regular email message and what needs to be sent using secure data transfer services. So any protected health information or patient information cannot go through text or email. It might be a good time now to help families access or sign up for maybe their personal public health record if their provider offers that, using that secure system to send messages back and forth. So that might be one thing that you can do to support families and kind of continue to be connected to their healthcare and patients, excuse me. So diving into conducting virtual home visits, let's talk first about contacting families and patients. What does this look like? Oftentimes it's going to be on the phone, but there's going to have to be some information that you can take down so that you have that with you. And that's going to include, pretty basic stuff. So the location where you're going to be doing visits, or if I'm calling you, where are you sitting so I know who's in the room? Their phone number, if there's a person outside of the house to contact in case of an emergency. So if you're working with an elder and maybe they live alone, and you're on the phone with them and you notice that there's some concerns, who outside of the house, or who else can we call if we have some, if we want to check and make sure everything's okay. Making sure that patients provide some type of consent. Right now it might be verbal for remote or virtual home visits. And then what is their capability for video chat? So again, there's all these different types of apps to use. So you have to kind of look at what is allowable by your agency, and then what does your patient or participant family have access to, and what can they use? And hopefully those kind of conjoin together and you find something that'll work. But if all else fails, try the telephone, okay? And then document that platform so we know, what a family has access to, what they know how to use. We want to take into consideration if it's secure, and then what are some virtual requirements. And I see in the chat box there's some really big comments, and I think that these are great. So I want to just bring your attention to the settings in the chat box. Try to change it to all panelists and attendees, because you guys have great comments that sharing these with other CHRs is going to be super important. So we want to make sure that when you post something in the chat, everybody could see it. Darnell said that his staff is picking up and delivering meds, again, transporting to appointments. and diabetes care packages. Those are really important too, because getting supplies right now might be really challenging for folks. All right, so touching on privacy and confidentiality, this is a big one. Again, we want to be aware of who's in the space with the patient when we're talking to them, either on video chat or a phone. We want to let them know where we are. So if I'm in the house and my kids are all behind me and everybody's listening to my conversation, my participant family may not be very comfortable with that. So making sure that you have, if possible, because not everybody has an in-home office or anything fancy like that, but just kind of trying to find somewhere that's going to be private. And then telling participants what you plan to discuss during the visit, so giving them a heads up. And then we always encourage you to wear headphones so that in that way, you know, if you're video chatting and you have your phone on in front of you, not everybody's going to hear what you're talking about or hear what the patient is saying. They're going to be hearing, just you will hear it. When you're, you know, in the visit, double check that they're in a private space. Confirm again that you're in a private space, and then avoiding sensitive subjects. We know that, you know, when we're face-to-face with families or participants and patients, we can talk about some pretty personal stuff, but during this time we want to kind of just be aware of, you know, where's that balance of things that we can talk about and things that maybe we don't want to say in front of other folks. So thinking about, you know, these ideas about actually going into the home, what are you going to do? You know, we're getting into the home now virtually, so it's on the phone or on the video, but what do we talk about? Well, definitely we want to check in with them, see how they're doing, if there are any resources that we need. But we always, as health educators and home visitors and health workers, we have this duty to continue providing education, right? It may be education that is related to what's going on right now with COVID, but it might be education that relates to their family or their healthcare. So how can you deliver that education to folks during this time? Well, we have a couple ways. So you could mail it, old school, right? Throw a stamp on an envelope, send them a couple worksheets. You could send it to them in electronic files. So if they have access to email, this wouldn't be something like their medical record, but if you have a worksheet or a tip sheet, you know, we can send those, I think, through email, as long as it doesn't have patient information. And then sharing materials during a video chat. So, you know, holding up what you're talking about so that folks can see it during the video is perfectly fine too. Looking at frequency and duration of the visits, we want to be understanding that the focus of the visit, you know, might shift to the immediate needs of the family as they're dealing with impacts, and this is okay, right? So we want to make sure that we're helping the patients and participants manage their stress as we do with other stressors. And we want to support them to understand the impact of stress on their families, on elders, and how this is impacting us. So we should be really continuing to support the relationships in the context of what's happening. And part of this is we're going to see that there might be some adjustment in our schedules. We want to continue having that structure of checking in, checking on resources, providing education, asking for them to, you know, confirm what they learned with us, and then wrapping up. That's, you know, a pretty general structure that we all do when we go into the home. And we can continue doing that on the phone. But we might have to be creative in how we deliver that education, for example, right? Families or participants may be more interested in the visits right now because they're home, number one, but number two, you're probably providing some information on what's going on and they're interested to learn more about that as well. Shorter, more frequent visits might come up as you're going through. So, you know, this 55-minute or 45-minute visit might not be reasonable virtually or remotely, but so maybe you transition to more of a shorter visit that happens more frequently. And then documentation, we'll talk a little bit more about that, but it is required, and we want to make sure that whatever you're covering, that you are documenting that. Social support visits, those visits where we're just there to merely provide support and maybe resources such as food and medications, these may increase. And you guys talked a lot about that in the chat box, you know, delivering food and medications and diabetic supplies. We want to maintain our own boundaries and be mindful of our own mental health, because some of these more social support visits can get very draining on us. So know who your resource is. How are you going to fill up your own cup? Because we can't fill anybody else's if ours is empty. And then having some community resources and hotline numbers available. So maybe you're texting them to folks that you're working with, or you have a couple of pieces of paper in your car that you can write down a couple quick numbers and leave with the medication. How are we going to disseminate that information to families? It's important to have a plan for. With regards to enrollment and consent, we touched on this briefly, but enrolling new patients, you may be enrolling new patients, you may not be. So we have heard from programs all over the country that are experiencing different outcomes right now. Some are saying, hey, our numbers are staying the same. Like, we haven't lost any families. They're more engaged right now. And then others have said, we haven't had as much contact because so much is going on. So, it's different for everybody. Taking into consideration who do you typically receive referrals from, and again, communicate with them. You might look for new sources as different programs are popping up to support communities. We want to check with funders. So whoever your funding comes from, and a lot of it's from IHS, knowing what are their enrollment requirements right now, so that you are aware of any changes to that aspect. And the defining new processes, like I said before, you're not at the fax machine to get a referral. So how are they getting to you? A lot of times right now they're going to supervisors by phone or email, and then the supervisor is calling the home visitor and saying, hey, you need to touch base with them, and this is your new patient or new family. And based on IHS organization policies, determine what is a valid consent for virtual or remote home visits. So a lot of places are using verbal, hey, you consent to us doing a home visit over the phone, and documenting that, or DocuSign, an electronic way to sign contacts, but we want to make sure that they're contactless, right? So we can drop them off, we can mail them. There's a lot of different ways to do it. We just want to have kind of that protocol in place. Okay, so now let's move into some documentation and virtual visits. Starting with this, so I want to dive into documentation. It's everybody's favorite topic, right? And maybe we could do this. So I don't know if you guys can do the thumbs up, but maybe in the chat box, have you heard that if it's not documented, it didn't happen adage? So I hope that there are a ton of you who have, because it's very important to take into consideration right now. And then we're going to start here with the IHS guide for paraprofessional virtual home visits. This is something that was hot off the press, y'all. It came out just today. So I just kind of pulled a couple of things from this document, but you can access it for right now, just the short term. There will be a link at the end of this presentation to access this document, but long term it will be available through the IHS CHR program website, okay? Taking a quick look at it, we will, thinking about documentation, and HIPAA and all this good stuff right now, it's hard because we're not in the office, so we can't document everything in EHR. Some of you can, some of you cannot. So for those of you who cannot document in EHR and you're having to do paper documentation, overall, this general rule is that, we're providing these services in good faith, right? We want to make sure that we're doing the best that we can to keep patients' information secure, and that we are doing the best that we can to document the services that we're providing. So documenting the home visit. First and foremost, you want to follow your organization's requirements. So, whatever that looks like, you want to make sure that you are aware of it and that you have access to and the resources that you need to complete those requirements. The platform is going to be determined by the organization. So if you have access to internet or electronic health system, that needs to be determined if you're going to be, documenting visits from home using EHR. Or, some of you might be using paper, right? We take a bunch of PCC notes or SOAP notes home with us, just the template, and we're writing out the notes that we are taking as we're taking them throughout the visit. So if you're doing that, you want to make sure that you're not leaving it out on the table for your family to see. It needs to be put away. We want to store records, away from natural and environmental hazards, so we're not throwing it under the sink with the rest of the, where it can get wet. We also want to make sure that it should include enough information to identify the patient, but have as few sensitive identifiers as possible. So we don't want to have their entire, chart information on their paper, but just enough so we can identify it and identify who it is. And maybe that is just a number or their initials. And then all documentation. So if you're doing paper at home, when you get back to that office, you're inputting it as soon as possible, right? We don't want it to be months later that we're still inputting information. When you get back, we need to get it into EHR as soon as possible. Okay. This just kind of talks about what you should be documenting. So, knowing if it's paper versus electronic, we talked about that, but also the date and time of the visit, how it was conducted. So how did you do it on the phone? Did you do it by video? Maybe it's text message, right? So how did you do that? And then any other, what you talked about. So the education that you provided, resources or sources of, resources that you provided or screenings that you may have completed during that time. Additional just reminders is to follow the organization policies, use sound ethical judgment to protect patient information, consider locking up the paper documents if possible. I know some programs have provided some locking like boxes or locking briefcases. Before I move on, because I know that that was pretty quick, I wanted to check in if anybody has questions about documentation. If you do, you can use the Q&A, but you can also use the chat box, and we'll keep moving on, but definitely let us know. So let's talk a little bit about assessments and screenings. These might be a PHQ-9, it might be child development assessments, it might be, there's a variety of things that you do in the home. So, and we still need to get those done. If you're thinking about how you're going to do assessments and screenings, there's a few things to consider. So one way you could do it is you can send them out in the mail, have the family complete it or the patient complete it, and then send it back. A lot of places do that. You also want to check to see, is it possible to do it by email? Can you send them an electronic link where they can kind of hit that link and then go and fill out a survey or a questionnaire that's secure? Can we send them a copy, like a PDF copy by email, if you have secure email? So knowing what your electronic resources are and what's allowable by your organization, and then maybe potentially thinking about doing them over the phone or on the video. So, just asking questions over the phone and having them answer you. And then how are we going to distribute incentives? So if you provide incentives to your program participants, what does that look like? You want to let them know, obviously, if they get an incentive, whether it's for completing an assessment or screening or just because they have completed a goal or there's an accomplishment or something you want to celebrate. And then thinking about how are we going to send them this incentive? Some folks are just dropping things off like they are food. They're sending them in the mail. Maybe it's electronic, like an electronic gift card. So there are a lot of different ways that you can do that, but we advise that you take a few minutes to really think about that and set up a plan or a protocol so that when the time comes and you're in the middle of your day doing all these things, you don't have to stop and figure it out. Now that we've talked about assessments and documentation, I wanted to touch for a couple of minutes on supervision. So what does supervision look like? Let's ask a couple questions in the chat box. So thinking about supervision, if you are a supervisor, how have you been managing supervision remotely? What does this look like? How does this look different now than it did before? And we'll give you guys a few minutes to answer and let us know kind of what you got going on. But many of you probably are already used to not seeing each other consistently throughout the week because we're often in and out of the field. And so that still is a huge advantage. You guys already are kind of used to that. But now thinking about how we can comprehensively support, excellent delivery of services when we don't get to see staff. A couple of different ways we'd like to introduce here. So one way is having the home visitor record their visit and then play it back for you, and you can kind of give them some feedback if you need to, or a three-way connection. Maybe they hop onto the video chat or hop onto the phone three-way. So those are a couple of ideas. And if you have other ideas that you have been using to kind of provide supervision, please use the chat box to let us know. We can share those with everybody. Next are just some quick recommendations for supervision. So, shadowing virtually, taking some time to help develop a professional development plan if you are not super busy. Helping by develop the resource list for your community health workers and providing those to them so that they can give those out to families. Reflecting on how remote work and reduced contact. So just taking a few minutes to talk with your staff and how this is so different and how you're managing it. You might want to role play virtual visits. So talked about meeting on the phone, meeting by video. Maybe before you put that into use, you do some practice together. And then gathering responses from staff related to how this is going, and if folks are feeling that this is working for them as far as our patients and participants. So Sabrina said that they're still in the office, and when they're not, they're using email to communicate. Great, thank you. Okay, at this point, we're going to hand it over back to Jamie. She's going to go over resources very quickly, and then we'll have a few minutes to talk about any additional questions that you all might have.
Awesome, thank you, Tara. So I know we want to leave some room for questions at the end, so I'll go ahead and breeze through these. Taking a look at the community resources and education that we can provide as community health workers. Next slide, Sarah. So here, as you know, with the COVID-19 pandemic, information is consistently changing on a day-to-day basis. So we want to make sure that we are sharing evidence-based facts and tips with our families. The Johns Hopkins Center site has a wealth of information that come in the form of handouts. So you are more than welcome to print those off for your communities. And also sharing local guidelines about social distancing, so when to go to the hospital and when not to go to the hospital. And as always, referring back to the CDC website, the COVID-19, for those information that are evidence-based. And then also when we are doing family home visiting, allowing yourself the time to show the proper technique of hand washing during diaper changing, for instance, is an excellent opportunity to share those resources with our families. Next slide. So here you might already have a comprehensive list of resources within your communities, but here are a few bullet points of nationwide resources that you are welcome to piggyback off of, but they're all listed here, and finding out what works for you and your communities. Next slide. Here I just want to point out that each of these websites have very in-depth information in regards to virtual or remote home visiting. Just today I was watching the first bullet there, and it highlights Denise Smith, who is the executive director for the National Association of Home Visiting. And in this particular presentation, she shares safety practices with home visiting. Healthy Families of America is also another great resource that provides guidance for healthy family sites in response to COVID-19. There's also a YouTube on training of community health worker guidance. And then there we have the HIPAA suspension of penalties, and that's in regards to telehealth. And then the Institute for an Advancement of Family Support Professionals. So here we have good information on tips and assessments that might be useful. Essentially, the Rapid Response Home Visiting Team is a great resource that'll provide best practice principles and strategies to support all home visiting professionals during this pandemic. And then of course, our Johns Hopkins Family Spirit Guidance for virtual home visiting. And then Tara, would you like to touch on this last one?
Yeah, I just wanted to remind you all that this IHS, the COVID-19 interim guidance for CHRs, that is the document that I had gone over near to the beginning. So it is fresh off the press today, and this is the link to access it. I'm going to put that in the chat box so you guys can all get to it as well. But if you want to, I know I've kind of been putting the link to download all of these materials, so you can do it there as well. So this one here is to this document in particular, but you can also download the entire slideshow or yeah, PowerPoint slides.
Thank you, Tara.
All right, so there is a ton of stuff here. Take your time. I know that I'm sure Amy mentioned it, but there's this readiness reflection from the Institute for Advancement of Family Support Professionals. That is a quick little assessment that you can use that'll help you determine what families have access to and kind of the right questions to ask. So it's a great resource as well. I know a couple of folks said that they're working with some elders who don't know how to use technology, and that's understandable. And I hope that you have access to the phone to at least give them a call. I did hear from one CHR recently who said that they were using the CB radio, right? For those folks who are super far out and don't have access to telephone or internet, that they're just kind of checking in on the CB radio and making sure that everybody's that they're getting a response. And so I think we're all pretty well versed at getting in where we fit in, right? Michelle, did you want to chime in?
Sorry. I think that all these resources mentioned are just wonderful ways to add to your knowledge with your program, and so check them all out. Thank you very much.
Thank you. Awesome. All right, so we have about 10 minutes. So I want to leave some time for questions, and I'm just going to put this up here. So this right here, I wanted to let you all know that webinar in this series, as Michelle mentioned earlier, but the third one, so next week at the same time, is going to be talking about CHR best practices. And what's really unique about the session that we'll have next week is that it will feature panelists from programs across the country who are, going to share what they have been doing and how their programs have been adjusting and coping with everything that's going on. So it'll be a really great time to hear from other programs about, for tips and ideas of ways that you can provide services to your communities. So again, in the chat box, I will put that they have the Eventbrite that you all used before, but I'm going to set it here again so that if you have not registered for next week's webinar, that you take a second to do that to join us, because I think it'll be really helpful. Sabrina in the chat box asked about the sessions being recorded and where can we go back and look at them. That's a great question, Sabrina. So all of these are being recorded and they will be uploaded to the IHS CHR program website. I imagine it might take a little bit of time to get them up there. We're not really sure how long, but they will be there. So keep checking that website periodically to see if they are available and when they're available, okay? All right, so how are we all doing? Do we have any other questions? Or any stories to share? So, maybe thinking about one thing that you have found to be really challenging right now. Is there something that you're really struggling with as a program or even on an individual level that we can kind of put out there to the group and see if anybody has any ideas to support you? Thanks, Christian and Darnell. You guys are great. I see there's a couple of hands risen. So Florencita, hi. I'm gonna, so I pressed to allow you to talk, and you're unmuted. Do you want to say hi about anything or ask a question? Okay. Pamela. Oh, I lost you. Hi, Florencita. We can hear you. Did you have a question or want to share anything?
No, thank you. I just want to say thank you for all the information.
Absolutely. You're super welcome. Thank you for joining us.
Yes, thank you.
Great. Well, it doesn't look like we have too many questions at this point. So I am going to kind of leave everything open for a few more minutes, and we'll give some time in case you all do think of questions or a challenge that you're experiencing that you think maybe everybody might have some thoughts about our stories. And then we will close down at 1 o'clock or at the top of the hour. It's 1 o'clock here in California. So.
Hey, Tara, it's Michelle.
Hey, Michelle.
Yeah, I was reading through all of the chat, comments, and I am just super impressed about all the innovation, the creativity, and I love the parking lot bingo. Ideas that, programs are out there working on community engagement, community outreach. And I guess I just want to say, there is no one way to do any of this. And all the different ways that you as CHRs are, reaching your communities, go with what works. If it's parking lot bingo, go with parking lot bingo. We are, Tara and Jamie, they've done just a fabulous job of providing, information around that virtual home visit that, we might be moving into. And so we hope that you take this content and that you use some of it, bring it in, adapt it, build on it, and look back to Tara and Jamie, myself, and let us know how it's all working, because you're the ones out there who are really I guess working with the patients at that direct level, and so we learned from you. So that's what I really wanted to say.
Great, thank you, Michelle.
Thank you, Michelle.
So Arlene in the Q&A said thank you. You're welcome, absolutely. Great. Sabrina says that, the parking lot bingo. So this is the first time I've heard about parking lot bingo, but it sounds so intuitive, right? I mean, hey, you could play bingo in your car. That's okay. That's fun. We've been playing games online virtually too, like a game night, and it's been really helpful. So great, thank you.
I'm trying to look for the parking lot bingo. The comment. Oh, there it is. That is so cool.
And this last slide here, so these are the folks at IHS. So Michelle, who you've heard from, and then Alberta and Tina. So their contact information is here, and they can definitely support you in, some of this programmatic stuff and finding out what's allowed and what's not allowed for your site. So please feel free to reach out to them if you have questions and for, additional support. And then I'll put my email in the chat box so that you can contact me if you have any questions about, this presentation or just home visiting in general. Sabrina put her email in the chat box as well if anybody wants to know about parking lot bingo. So I'm going to actually put that, I'm going to repost it, Sabrina, because if we put it to panelists and attendees, then everybody could see it. You guys can contact Sabrina if you have questions about parking lot bingo. See who holds the wheel. Great. All right, everybody. Well, we'll probably go ahead and conclude there. If you have any questions, reach out to us via email or phone. We're so thankful that you all were able to join us today, and thank you for sharing, you know, what you're up to and what you're finding to be super helpful, and all these creative ideas for staying connected and providing such great resources and support to the communities as far as food and medication and testing. This is all, you know, what makes everything, you know, what makes it work around here. So it's wonderful. Thank you.
So we have it from Bobby asked if we contact myself or Bingo. Unfortunately, no, but it would be Sabrina. So I'll go ahead and copy off her email again. I'd love to learn about that.
And I think this is Sabrina's email. There you go,
Thank
Bobby.
you.
So that'll be there for you. Great. All right, everybody, have a good rest of the day. Enjoy the rest of your week. Thank you.
Thank you.